Convergent AF ablation therapy is a technique which can be very effective for certain groups of patients with atrial fibrillation, particularly those with what we call is long-standing persistent AF, those who have the atrial fibrillation for quite a long time, which is much more difficult to treat by other standard forms of ablation. In convergent AF ablation therapy, there are two components and two stages. One stage is to deliver the ablation or currents of energy to the outside of the heart. And this is done by delivering an electrode by a small incision just under the breastbone, under a general anesthetic, by a surgeon, and accessing the outside of the heart, which takes about an hour, and the patient can often go home on the same day. The next stage of the ablation is by delivering currents of energy through the inside of the heart. And this is done by delivering the electrode through the top of a vessel at the top of the leg, advancing it to the heart through the inside of the blood vessels, and then delivering currents of energy to the inside of the heart. And the advantage of doing both of these approaches is that the muscle of the heart can be quite thick. So delivering currents of energy from the outside alone or the inside alone may not penetrate the full thickness of the muscle and may therefore be ineffective in treating the atrial fibrillation. When we use the convergent approach, which means delivering currents of energy from the outside and the inside, the energy is then transmitted to the full thickness of the heart. The benefits of convergent AF ablation are the success rates, which are greater than the success rates of standard endocardial catheter ablation alone in certain selected groups of patients with atrial fibrillation, the ones who have the more resistant type of AFib. AFib is an abbreviation for atrial fibrillation. The success rates are significantly greater in carefully selected individuals who have this condition. And the beauty of this approach is that the patient can be discharged the same day or the following day after the convergent ablation.